Good evening. This is Lyle. It is Friday, March 8th, 2024. Um, I I had my chemo infusion, the third one, finally after testing okay for white blood cell count on Friday of last week. So it's been exactly a week since I had the infusion. Of course, I had to have the pump for another 46 hours. The pump was disconnected on Monday. And I had a fairly rough week as far as just being really lethargic and foggy in the brain and everything else, and a little stumbly and folly every now and then. I never fell down, but lean and fall into things, that kind of thing. Um, so it was a little bit of a pain. This time I was able to avoid the constipation that I had last time, which was really a pain because it opened up that fissure again. But luckily, with all the time that I had, because of the low white blood cell count, I was able to heal up pretty good. So anyway, this time I was doing my Metamucil and the things, and everything was okay until today, when all of a sudden I had a bunch of urgent bowel movements. I had like 4 or 5, a real pain in the butt. But anyway, just one of those things. I just didn't feel my stomach just wasn't comfortable. So I ended up taking the first thing I've taken this time in all these treatments, which was an Imodium. And that seems to have fixed everything for right now anyway. So my next, hopefully this weekend and next week, I can kind of get back to a little more normal, be able to drink things at least room temperature without having to warm them up at all. And hopefully the whatever caused this diarrhea, almost, it was not total diarrhea, but it was pretty close, will go away. And I'll do labs on Friday of next week. And provided that my immune system is still hanging in there, I'll be able to do infusion on Monday. And I'll have my appointment this is a week from Monday on the 18th, with the hematology oncologist, Dr. Kasana. And then I will go directly from there down to do the treatment, provided, again, my immune system's good. So everything is still progressing. That'll be the 4th treatment, and there'll be 4 more that I've got to deal with. If everything stays on this track, I will be, the last treatment would be the 15th of May. Of course, that's subject to having any of my tests come in bad and having to wait longer time again like I did this last time. So anyway, again, it was kicking my butt a little bit earlier this week. I'm starting to get better. The fog kind of lifted yesterday. Still not always perfect, and still can get tired without warning, but it's getting better again as we progress in the weeks, in the back end of the 2-week period. But of course it's cumulative, so as I do more and more, you never know how long I'll have. Anyway, just an update. First off, please, everybody, get your colonoscopies and your cancer screenings, because they really do save lives. And secondly, my wife, who had a artificial heart valve implanted a week ago Wednesday, is starting to do better now. Her pressure on that valve that was only delivering 25% blood flow to her body was 35. And after the new valve, the first echocardiogram showed that it was down to 12. So she's improved almost threefold as far as, lowering the pressure. Now that she has the stent in the Widowmaker to knock out that 90% blockage, everything is getting the blood it's supposed to get. It's just getting her back into some sort of condition after having weeks of not being able to do anything. So anyway, that's where we are. We're still trying to muddle through this, helping each other as we can. And so I, again, just urge everybody to make sure you get your screenings, both heart, any issues that you have, make sure somebody looks at it, because I've heard so many stories now about people that waited too long or put something off and then it came to a disastrous end. So anyway, have a great weekend. This is Lyle. Thanks. Bye.